going to going to discuss regarding biphosphonates, bisphosphonates. So briefly we discuss regarding bisphosphonates. It is an analog of the pyrophosphates, and it's analog of pyrophosphate. How the same work of the pyrophosphate work is the bisphosphonate also work. So the drugs are the pamidronate. It's given in the through the IV, and alendronate. It is also given the oral, and there is zoledronate, and etidronate. This is etidronate is given IV and oral, and zoledronate is only given for the IV, and telodronate or is given the oral, and the risodronates are given the oral. There is some group of drugs like oral, and IV. So these are the drugs. So when we look at the mechanism of action of this drug, this is anti-resorptive effects. Like in the bone, there is osteoblast, and osteoclast. So when osteoclast is active, there is a bone resorption occur and bone destroying. So osteoclast activate the osteoblast. So osteoblast also help to the formation of the bone. So in this case, when it's inhibit the when increase the bone osteoclast activity, so this drug help to the bone area of the bone resorption where the osteoclast activity is increased. So it inhibits the osteoclast activity, and when it's activated, so there is like osteoclast, the cell of cells. These cells die through the apoptosis, and there is a decreased osteoclast activity, and there is a decreased bone resorption. So also it's by the intervening or by the interfere with the mevalonate pathway, which is help to the synthesis of cholesterol synthesis. So it is required for the formation of the normal function of the like osteoclast for normal functioning, that needed to the this pathway for the synthesis. So if the impaired with the impaired with the mevalonate pathway, and that lead to the osteoclast activity decrease, and that lead to the decreased bone resorption. So this the important mechanism of action for this, there is some drugs like alendronate and risodronates. So when we look at the pharmacokinetics, it is a highly polar. So it is poorly absorbed through the GI, and when we look the absorbed drug is incorporated into the bone. It's go into the bone and incorporate the bone, and then remain long term, like month to the year, and the free drug excreted through the unchanged in urine. So without any metabolism occur through the kidney, this drug passes in the urine unchanged form. And the drug zoledronate has a less irritant effect on the injected vein, but other have more irritant effect. So it is given in once a year. When we look at the usage of these drugs, so it is mainly used in the Paget disease, and like in Paget disease, biphosphonate treatment for first choice. There is treatment choice of Paget disease. There usually clinically, so it's reduce the alkaline phosphatase level, and also reduce the bone pain. And when we look at the prevention of the treatment of the postmenopausal osteoporosis, like in the female after the menopause, there is decreased estrogen, and when estrogen decrease, there is more osteoclast activity or bone resorption occur. And when bone resorption occur, and in that case there is also you can use, and when bone resorption, bone destruction occur, and that lead to the painful bone fracture of the bone in the female after the age of the 50. So in that condition, we can also give this by bisphosphonates, and this drug improve the mineral density, and also reduce the incidence of vertebral fractures. And when there is if the increased number of corticosteroids, and that lead to the increased osteoporosis. When in this case, when in the osteoporosis case, so we can also use this drug. So it's with the oral calcium carbonate. When due to this corticosteroid, there is osteoporosis more, and this oral calcium carbonate, it helps to the binding and osteoblast activity, and there is more calcium in the blood, so there is a more strong bone and there is less resorption. And in the some malignancy, there is a hypercalcemia. The biphosphonates also help to the control the hypercalcemia by inhibiting the bone resorption. Inhibiting the bone resorption decrease the bone inhibiting bone resorption, and zoledronate is the most potent in the drug as per the malignancy of hypercalcemia. Like in the plasma, there is more increase of the calcium due to the malignancy. The malignancy malignancy lead to the increase the calcium in the plasma, and when this lead to the hypercalcemia. So biphosphonates help to the, or zoledronate help to the control the hypercalcemia in the malignancy cases. So there is bisphosphonates also useful in the control of the hypercalcemia and hyperparathyroidism. So in the hyperparathyroidism condition, there is an increased parathyroid hormone, and when parathyroid hormone is to increase more bone resorption, and that lead to the increase the calcium in plasma. So increase the calcium in the plasma, that lead to the due to the hyperparathyroidism. So hypercalcemia of the hyperparathyroidism lead to we can use in this case. Also, this drug relieve the pain and lytic bone lesion. Like when the bone is fracture going on and there is a painful, so it's decrease the pain of the bone. When we look at the adverse effect of this biphosphonates, they mainly include the nausea, vomiting, diarrhea, heartburn, esophagitis, and peptic ulcer, fever, myalgia, muscle pain, and hypocalcemia. Hypocalcemia also occur. Headache, skin rashes are seen. Oral biphosphonates should be taken with plenty of water. Patients should remain upright for at least 30 minutes to prevent the esophagitis. So and there is a flu-like symptoms and also occur on the parenteral given the drugs, and rarely osteonecrosis occur of the jaw may occur. So these are the some adverse effects. So drug useful in the hypercalcemia, how in hypercalcemia, which drug? Biphosphonates and the mithramycin inhibit bone resorption, and glucocorticoids decrease the calcium absorption and the increase excretion. So that leads to also furosemide. Furosemide help to the excrete out more the calcium, excrete out. And there is the strontium ranelate that inhibit the bone resorption and useful treatment of osteoporosis. And also denosumab is a monoclonal antibody which helpful to treatment of the osteoporosis, bone resorption inhibited, and its admission once in subcutaneous once in 6 months.